I think we'll get started and as and when people join, they can become a part of the session. So thank you, everyone. Thank you for joining us this afternoon. Welcome. For those of us in Mumbai, we're enjoying good weather for a change. So on that note, I see a few names that are familiar. For those of you joining us for the first time and don't know me, my name is Devina Nigam. I'm a consultant at Atma. A little bit about us. Atma is an accelerator for education. We're an organization that supports education NGOs largely to become stronger by building capacities and creating systems and processes that support them and solve for any issue that they may be facing, especially with respect to organizational development. We started our journey in 2007, and since then have supported over 85 organizations in their journey of excellence. Um, at Atma, quite early on, we understood the importance of shared knowledge, as would all of us present here have. Um, Especially in a sector like ours, where resources are fairly limited. And this is really the genesis of the webinar series. So webinar series started as a space where we could share our perspectives, learnings, ideas about issues that NGOs face on a daily basis. Um, Atma Webinar is a curated platform where speakers share their practical experiences that could benefit other organizations, other NGOs. Um, Topics, of course, there's a wide range from human resources to finance management to fundraising, program management, uh, essentially any topic that affects us as a whole, affects the whole sector. Um, Today's webinar, we're going to talk about how building strong monitoring, evaluation, and learning practices for an organization can go a long way in supporting them in their impact assessment. Today's session will help us know more about action research and its practical usage for each of our organization's programs. Three things we can look to take away from the session. Understanding various research and evaluation methodologies that can be applied to impact assessment. How to use research data for program design and decision making, and research related compliances. Our speaker today, Divya Agarwal, she's an assistant manager at Samhita Social Ventures. Um, Divya is a social sector and policy researcher with a background in law. She has led field research in pilot programs, and at Samhita, she has anchored impact assessments, community needs assessments, program evaluations, and social return on investment studies, spanning across a variety of thematic areas ranging from agriculture, health, education, skill development, women empowerment, among others. Her goal is to facilitate the creation of a strong evidence based development research paradigm in the hope of bringing about larger change with maximum impact. In her leisure time, she likes to explore new places, experiences, and ideas. Welcome, Divya. Um, Before I hand it over to you, I just want to call out a few rules for our session today. I request all attendees to kindly keep their audios on mute while the webinar is on. We definitely want to hear from you, so please use the chat box quite generously. Put in your comments, suggestions, questions. We will take them up during our Q&A session towards the end of the webinar. Um, as you know, this session is being recorded and we will share the recording with all of you. So please feel free to share it in your network. Um, Lastly, very importantly, please do not leave the session without sharing your feedback with us. It is so important for us to hear from you. Um, with that, over to you, Divya.
Thanks, Davina. And good evening. And, thanks everyone for joining in on the session. I think Davina has already given quite a context on what we are going to do today, and I'd like to add to that. Just to take you through the structure of the session before we begin, so that you have an idea of what to expect at what stage, and sort of keep your queries ready for those times. And like Davina has mentioned, you can always use the chat box to keep entering your questions, and we can take them up as and when appropriate. So I'll just be presenting my screen. Give me a second. Right. So I think firstly, to go over the structure of the session, like Davina has mentioned, the idea behind the session today is to see how implementation organizations can also be learning organizations, how they can help organizations that carry out research either as partners of these organizations, or as we see something that very commonly happens these days due to various compliances, various practices that are now global best practices, wherein third-party organizations are often brought in to assess programs. What happens, however, is that there exists a gap between the expectations of research organizations and the practices of implementation organizations. And the idea here is to bridge that gap so that research is allowed to showcase in totality the work that is being carried on by implementation organizations. As researchers, it is very common for us to go to the ground and observe um, the kind of brilliant, the very commendable work that is done by organizations, especially those that have been doing there are experts in their specific domain areas that have been working in those domain areas, and perhaps even geographical areas where for many years. And what this tends to do is this creates a huge you can say in a way a web of work, a web of interconnected work that they end up doing, which is not very easily defined. And what makes it more difficult for us to showcase that as researchers is when there is a lack of documentation, if is when there is a lack of any kind of data that tracks the progress of the stakeholder groups across the years that an intervention or a program may be carried out for. So the first thing that I would like to focus on is to familiarize you with the kind of assessments that we do. And the way that I have structured that is to look at these assessments as and when they happen in the program life cycle, right? So I'd like to familiarize you with when a certain kind of assessment or when a certain kind of research study is carried out, what are the steps that are required for that research study. That will help you understand as implementation organizations what kind of information is necessary for you to keep, to document, that will help any kind of researcher who comes in, whether they be internal to your team or whether they be external, to actually use that documentation to showcase the work that you have done. I will also be touching upon some common terminologies that are used in terms of the methodologies and the methods or the tools that are used to carry out these research studies. I will then be talking about the importance of monitoring, evaluation, and learning, and how that is a little bit different from assessments. And that is also where an implementation organization's role becomes more important than that of external researchers. And lastly, I'll talk about the role of non-profit organizations or implementation organizations in documenting these kind of practices, in ensuring that they have a robust MEL practice, and that which can also assist in external research studies to showcase the totality of their work and the totality of the impact of their work. Uh, Beginning with the types of assessments, like I mentioned, I'd like to go in the order of when assessments are usually carried out in a program life cycle. The first assessment that we are looking at here is actually carried out prior to any program beginning, prior to the initiation, or even in some cases, the conceptualization of certain programs. This is something that we see companies coming to us again and again to uh, do these kind of assessments in order to ensure that they go into the geography that they want to look at, or they start engaging with the stakeholders that they want to engage with a prior idea of what the needs are. So this is a community needs assessment. Uh, all of you are probably familiar with the terminology as such. What a community needs assessment is a tactical way of analyzing gaps that exist in the community, in any community services, the services that may be received by them. There are social services in the general social needs of the community, even without the services that may be not present there, or they may not even be common to that geography or area. And the idea is to look at these gaps from the lens of what can be done. So when we look at these gaps, the idea is always to see which of these can then be fulfilled by, say, the corporate or an implementation organization that is within the scope of their own work, that is within the scope of the domain that they practice in, within the scope of their resources, and try to combine that with the resources that are present in the community to create a robust program design. I've included here the steps that are required to take up a community needs assessment. One of the first things that we do in a community needs assessment is to define or identify the community. A community can have a number of limiters or a number of definitions that allow us to narrow the scope of the target stakeholder group that is going to be part of the program. A community may be defined as the people who are resident in a certain geography. A community may be defined by other parameters, such as, say, people residing in a geography of a certain gender, persons residing in a certain geography of a certain age group, of belonging to a certain religious or caste identity. These allow us to focus our assessment that happens, so as to go in with a very clear idea of what is the community that we are going to be looking at for the program. That helps us define the next step, which is the assessment criteria or the scope of the assessment itself. uh, while going for any assessment, whether it be this community needs assessment or any other kind of assessment that I'm going to speak about in the session, there is always a component of secondary research that we carried out, which helps us go in prepared in terms of what are the needs that have already been identified, what there may be already research that has been carried out in terms of that particular community that we have identified as a stakeholder group. And this helps us determine the assessment criteria to ensure that we don't miss out something by going in with a very generic idea of what we need to assess. And that brings us to the second step that I've already kind of spoken about, which is the determination of the assessment criteria. To give you an example, or to carry on the example that I've given earlier, for example, if we have defined our community as, say, adolescent girls in a certain geography, our assessment criteria here would then center around the issues, the needs, or the expected services that we hope for this community to be receiving, or for this community to receive in the future, to lead what we may determine or what we may consider a certain standard of life. So, for example, here we would look at the education that is being given to them. We would look at whether girls are being sent to schools, whether there is any kind of barrier to education specifically for this community, knowing that there is often, or there is sometimes rather, a mindset of not sending girls to school beyond a certain point. We would look at the what are the kind of barriers of education that exist. We know already, for example, I've already spoken about the cultural mindset that may exist in some places where girls may not be sent to school beyond a certain age. We would then look at, are there other barriers to this education? Is there a lack of, say, clean toilets? Is there a lack perhaps of toilets at all in these schools, which is acting as a barrier for adolescent girls to go to these schools? Are there other physical barriers such as distance, which may be discouraging girls from going to schools, the lack of transport? So these are just some of the examples, but this is the kind of assessment criteria which helps us formulate the final tool that may, in this case, be a quantitative survey that we'll use to assess the needs of the community. The third step is the data collection, where we plan and execute this. At Samhita especially, and in generally in most research organizations, it is now a recognized best practice to go in with a mixed methods approach. What this means is that we do quantitative as well as qualitative data collection. Quantitative data simply means collecting data from a certain number of the primary stakeholder group, which in this case, like I've mentioned, would be the adolescent girls in a certain geography. So we speak to a certain statistically robust number of those primary stakeholders. And the questions that we ask tend to be more close-ended. So there would be, the questions would be, there would be more options than there would be open-ended questions. And the idea would be to take these to give us trends for all of these. So for example, when we ask a question about the presence of toilets in schools for the adolescent girls that we speak to, the quantitative survey will give us a number. It will say that 56% of the stakeholder group, for example, has access to gender segregated toilets in their school, right? The second is the qualitative data collection, where we take up more methods. I will speak about this a little bit later in detail, the methods that we use for that. But essentially, these are more open-ended methods where we try to go in depth and have a conversation that is not closed off by any options, where we give people that we speak to, the stakeholders that we speak to, the chance to give go in depth into the details of or the nuances of an issue that may not necessarily be something that we may have considered while creating the tools, while especially while creating a quantitative data collection tool, where we tend to put in options already. And this gives us the opportunity to firstly fill in the context of our quantitative data. So when we say 56% of girls only have access to gender segregated toilets in this area, it is the qualitative data that gives the context to that. For example, we may realize through the qualitative data collection that the village that we are doing this in, which is the geographical ambit of our assessment, may not have access to running water at all. In that case, it is not going to be a practice to create toilet. It is possible that there is not a practice of using toilets even at the household level or any other levels in the village due to a lack of this, right? So that is what we do with data collection. We plan to speak to as many stakeholders as we possibly can within the scope of the CNA or the assessment criteria that we have defined. So in this case, we would speak, of course, to the adolescent girls of the community. We would speak to the stakeholders of educational institutions in the community, such as the principals or headmasters, the teachers of the schools. We would also speak perhaps to general community members, to the parents of the adolescent girls. We would speak to the community leaders. We might speak to certain members of the government bodies or the panchayat or other such governance bodies, which we feel are essential in giving us a sort of macro view of the community and its needs within the scope that we have defined for our CNA. The fourth step, which is you'll see is common to all assessment methodologies that I'm going to speak about, is data collation, cleaning, and analysis. This is where we put together all the data that we've collected from various sources. We clean the data to ensure that there is, outliers are taken care of or not included in our general trends. We clean data to ensure that any kind of data that is perhaps not correct in term or that exists as a result of a human error or any other error is cleaned out, and we do an analysis. Finally, this gives us our findings, and what that allows us to do, or what we need to do as a next step to a CNA in this case, would be a prioritization of needs. Now, what happens usually is that what I have defined, or the example that I've been using as of now, has been a fairly focused example. It's already narrow in its scope. It has a very, very well-defined stakeholder group. It has a very, very well-defined community in this case, right? And that kind of narrows down the needs or the thematic areas of which we are going to assess. What can often happen is that when there is a broader community that has been defined or a broader assessment criteria, for example, a corporate or even an implementation organization uh, maybe intending to go into an area without any defined scope of their intervention. In that case, when we look at a general community, a community at large, the kind of needs that come up can be of a very wide variety. We also have things which are, there are perceived needs, there are needs that are reported and also observed by, say, the researchers or by third-party assessors, that therefore sort of triangulate and establish the actual presence of that need. There might be some needs that do not easily come out of just quantitative data, but may have come out a lot in qualitative data collection. So these are just some kinds of needs, but even in terms of thematic areas, we would have a lot of needs. So for example, continuing with the example that we've been using, we might see that there is a lack of toilets, and which may be a barrier to education for girls beyond a certain age. say girls beyond 13 or 14 may not be comfortable going to schools when they don't have access to a toilet, especially a gender segregated toilet. At the same time, we might there might be a need that could have come out, which says that girls would like more free time. There are chores that are being given to them, say beyond their school hours, which do not allow for them to give enough time to their education, or which may not give them enough time to as much as say the boys in the village, to go back to their studies, to ensure that their homework is complete, ensure that they are able to engage in after school studying, ensure that they are able to explore opportunities for higher education or explore opportunities for livelihood that are supported by their level of education that they receive at the end of their schooling, right? So when we have this kind of variety of needs, the sort of second last step that we do in a CNA is a prioritization of these needs. We see what is the spread of these needs, what is the percentage of our defined community that has expressed that need, right? That is one of the ways that we prioritize our needs. The second is a very logistical but a very, very practical way, is where we look at the scope or the possibilities of the implementation organization or the corporate or anybody who is conducting the CNA, or anybody who is going to be the implementation agency for this for the eventual program that is designed as an end result of this CNA. What is possible for them? What are the domains that they work in? What are the resources that they have? Lastly, we also look at, and this is one of the major things that we do in a community needs assessment, apart from looking at the gaps or the needs that exist in the community, is to look at the existing assets in the community. Are there, for example, is there money with the school to build these toilets? Are there, say, government schemes that exist in that particular state that actually help schools out with creating, with building toilets for girls, right? So are there already resources that exist? Are there already assets that exist that help us create a certain program, or that make a certain program more practicable, make it more feasible for us to undertake? So these are just some of the ways in which we prioritize our needs. And finally, the sixth is the program design. This is the step where we look at all the findings that we have, that have come out of the data collection or of the assessment. We look at the prioritization of needs that has happened, and using that, we narrow down to whatever number of objectives it is that we want to narrow down to, and using those, we create a program design. The idea of a CNA is always to go in with the goal of creating a program design at the end. So one of the things that we do, like I mentioned, apart from identifying the gaps that may exist in the community, identifying the needs that may exist in the community, is also to look at the feasibility of a potential program design. And this helps us at this very last step to not just design a program vaguely, but design it in a very detailed, in a very, very methodical manner. We can use here a number of frameworks that, uh, you know, that anybody may, that in this case, the implementation organization, the corporate, may be comfortable with. Either a log frame, which we have all probably used fairly often, where we look at the inputs, activities, outputs, outcomes, and impact. We can look at a theory of change, which defines what is going to be the change that is carried out through the program, which looks at the existing, sort of facilitators of change, which looks at the existing barriers of change to define the program design. Is somebody saying something?
No, no, go ahead. Go ahead.
All right,
Vivek.
sure. Right. So this is a community needs assessment, and these are some of the outcomes that I've outlined here, that I've spoken of, which we get as a result of the community needs assessment. These are all the reasons why we do one. One of the things that also often happens is at the end of a program life cycle, when we are trying to assess the impact, or sometimes even when we are doing a monitoring of the efficiency of the program, one of the things that we try to see as researchers is why a certain program was created in the first place. Was there ever an assessment of the needs of whatever stakeholder group may be primary to the program? Was there ever an assessment of their needs before a program was enacted? There have been cases where we have seen programs being enacted and having to stop midway because of a huge gap in the outcomes that they have been able to achieve, and the outcomes that they foresaw, because of a non methodical or a very, very anecdotal or a very ad hoc kind of assessment that is done based on maybe say a few people's knowledge of a certain area or perceived knowledge of a certain area rather, I would say. And this is where a needs assessment becomes important. There is a lot of money, there's a lot of effort that goes into creating large programs, and therefore a CNA ensures that these are done for the actual needs of a community and not for any kind of perceived needs that may be perceived either by a very, very small not statistically robust section of the community itself, or in some cases by external persons who in many cases may be companies, or who in some cases may also sometimes be organizations that are hopeful of working in an area but do not have enough of an idea of the area to be able to define their needs properly. So that is where a community needs assessment becomes helpful for us, not only at the beginning in defining our needs, but also at the end in looking at the efficiency of the program and making sure that the outcomes that we want to achieve are achieved out of any program or intervention. The second thing that tends to happen, the term that I've used here is longitudinal studies, to explain that a longitudinal study is what we call a correlational research study, which means that it looks at a number of variables with the idea of discovering the relationships between these variables, right? So often an impact assessment, or I wouldn't call that an impact assessment per se, but often it may be claimed that the impact of a program has been a certain outcome, right? A certain change in the community that the program was targeting. But what a longitudinal study aims to do is to draw a link between that particular change that we are claiming is happened before because of the program and the actual program activities. Now, this term that may be more commonly used, that is something that I'm sure all of you have heard before, is baseline, midline, or endline studies. These are typically the studies that form a longitudinal study. What a longitudinal study essentially means is that it is a study that is carried out with either the same group or a sample from the same group of people at various periods of time. And this allows us to chart their progress, which is why it comes here at this stage of the presentation to say that a baseline is something that we usually conduct either right after or right before the beginning of program activities. And the idea here is to give us data on whatever indicators it is that we are aiming to change, right? So I think we will continue with the adolescent girl example here. The baseline will give us the number of, say, toilets that are present in the schools in our defined geography. It will look at the number of percentage of adolescent girls in that community reporting having access to a gender segregated toilet at their school before our program began. And that is what will help us see whether at midline, which is midline as the name suggests, is something that you do somewhere somewhat in the middle of your program. So for example, if it's a 4-year program, you do it at the end of 2 years. But this midline is not so well defined as to happen smack in the center of a program. It is something that you can do with where enough time has passed from baseline that you expect some change to have happened, and there is enough time yet to go for the program to end, so that you can use whatever information you have received at the end of the midline, whatever are the findings of the midline, to kind of feedback into or loop back into the program, use those findings to improve any, say, gaps that you found in the program. In terms of, if you found a gap in efficiency, you take care of that. Figure out how to overcome that gap. If you see that there is effectiveness is not so good, there is like the program is efficient but the outcomes that we are expecting are not being achieved, then we look at ways of how that can be done, and we have enough time to enact those, to make the modifications to the program that can help us plug those gaps or overcome those lacunae in outcomes. And by the end line, which is also sometimes called the end program evaluation, which happens right after the end of a program. So the idea is for a midline to happen at a time that we have enough time before the end line, so that these changes could have had an effect, and that can be tracked or documented during the end line study. So I hope this is not confusing. If it is, I would encourage people to raise their hand so I can repeat something, or if there is something that has not been clear, we can take a question about that at that point. But if there are any additional questions, I would encourage for you to, keep those towards the end. So this is essentially a longitudinal study, which is a study that is carried out either with the exactly same cohort of persons, or it is carried out with uh, a sample from whatever maybe your stakeholder group, but at different points in time in a program, in order to track or chart the growth of the stakeholder group on those particular variables or outcome indicators that we are aiming to target as a result of our intervention. The steps to a longitudinal study are very similar to an impact assessment study. The first is a creation of a strong theoretical framework with defined research questions. Now, this is something we encourage everyone to do, irrespective of whether they are planning to engage in a longitudinal study. A longitudinal study, as you have obviously understood or perhaps guessed, has a major drawback in terms of the cost that goes into it, the effort that goes into it. These are full-fledged studies carried out with a statistically robust sample of the primary stakeholder group. And also, like I've mentioned, we do encourage mixed methods studies, which means that we also speak to other stakeholders. So these are full-fledged research studies that happen at least two or sometimes four and sometimes three and sometimes even four uh, intervals of a program, which really brings up the cost of the program. It brings up the effort that has to go into conducting, four studies, as opposed to say, perhaps one baseline and one impact assessment kind of study, what we call cross-section studies. And apart from that, one of the bigger difficulties in the longitudinal studies where we do panel studies, which essentially means we speak to the exact same persons at baseline, midline, and line, or whatever stages we want to do a longitudinal study at, is ensuring that these people stay with the program, that they all participate equally at all stages. So usually, I mean, I'll come to what kind of things we do to ensure that. But one of the first things you do before that is to develop a strong theoretical framework, even if you're not planning to do a longitudinal study, because that is not within the scope of your budget or your program design, however the case may be. A theoretical framework helps us uh, do research not only at these points, not only at an impact assessment stage. That is something that is going to guide your monitoring and evaluation framework as well. Uh, as long as these indicators exist, as long as there is a framework that tells you what activities you'd like to put in and what are the uh, related outputs you're expecting, what are the outcomes you're expecting, what is the impact that you eventually hope to have, it is very easy to go back to those and see this is where we should have been and this is where we are, and allow for us to use that learning to feed back into the program to improve the program while we still have the time to affect any kind of change within that program. The second thing, like I was mentioning, is determining a sample and recruitment plan. So like I said, there are one kind of longitudinal study, which is a panel study, involves talking to the exact same group of persons across all periods of time where you do this kind of assessment. So a recruitment plan essentially is something that takes into consideration the fact that a lot of people may not be present for all uh, the times that we plan to do this assessment for. It kind of factors in whatever dropout ratio we are expecting. Usually we take something around 10% at each stage is something that we expect. That is actually a very, very conservative kind of estimate. There are programs, depending on the nature of the program, the nature of the engagement with the stakeholder group, this dropout ratio can be higher or lower. So the sample that you determine, the recruitment plan that you determine, needs to take into consideration that you're going to do the study at, not just once, but a couple of times at least. And how do you ensure that people stay within the assessment group? How do you ensure that the sample does not stray out? And not just stray out, how do you ensure that a sample is able to give you information that is representative of the entire group at all times, right? And how, if that doesn't happen, what kind of measures do you take to ensure that your study at different stages or at future stages will still have the authoritativeness that it should in terms of its this robustness of its sample of its sampling, which is not just in terms of number, which is also in terms of its uh, spread across the different strata within the sample itself, right? So for example, when we spoke about adolescent girls, we may want to ensure that there is representation of all castes of adolescent girls within that particular geographical area, right? We may want to ensure that there is a representation of all economic groups of adolescent girls who are present in that geography. So that is the kind of plan that you need to create for a longitudinal study to ensure that you have a robust sample at all stages that you want to conduct an assessment at. The third is the collection of data at baseline, which I said is the first step or the first longitudinal study that you do. It happens either usually or most ideally it should happen right before you begin the program, but sometimes due to logistical reasons, due to frankly the flow of funds happens such that you can only usually commission it after. But if a program has begun, a baseline should happen as close as possible to the beginning of program activities. The fourth, as I mentioned, you'll see this is common across every assessment study I speak of, is the collation and analysis of data. Here at this stage, you will create a baseline study, which will give you the baseline levels of all indicators that you're collecting data on or that you're hopeful of collecting data on in order to test or chart your program progress. The fourth is to use the baseline study experience to modify your study strategy. It is possible, specifically if you have not done, say, a community needs assessment before, or if you've done a community needs assessment that may have been larger in scope, and after prioritization and after narrowing the scope of your study, you've come to a stakeholder group that is a significantly smaller part of your needs assessment. You should keep some room to expect changes in the trends that you had noted earlier, or you should keep some room for improving or changing the program on the basis of the data you receive at that point, and to factor that in. This is also something that you should be prepared to do at other stages of the study before the end of the program. So for example, if you are having one or two midline studies, the idea should always be to use the findings, use the experience, use whatever information you've collected to feed back into the program and ensure that there is any modification that needs to be made in order to ensure that the program is on track can be done. And lastly, you sort of repeat this process at midline or endline. The outcomes that this gives you have been stated here, and I think I've already spoken of those. So I'll just move to the next study. Now, impact assessments, as we're all, I think this is perhaps the most common study that we see happening, specifically from last year, since there has been a change in the CSR law in the country and made it which has made it mandatory for programs, or rather for companies which give more than 1 crore to a program in a year or have an overall CSR outlay of over 10 crores to mandatorily engage an external evaluator or an external assessor, such as Samhita, to do impact assessment for their studies. Since that has become mandatory, I'm sure all of you who run implementation organizations have been approached for this. And to go by the mixed definition that we can create by looking at what is normally defined as an impact assessment by the social sector, as well as what is defined as impact assessment by the present law in force in India. An impact assessment essentially looks at the entire or the gamut of effects that an intervention would have had, which is not just outcomes, but the larger sort of impact on the community, not just the stakeholder group, but the community that they are within, not just on the target area, but on other areas which are interlinked with them in a way that makes it almost difficult for one to not impact the other. So to give you an example, again, continuing with the adolescent girl program, if an outcome of a program that we were to create that targets the building of toilets, that targets say the creation or the driving of awareness programs or any kind of behavior change communication programs leading to girls using toilets or demanding for access to toilets, leading to schools creating those toilets, and therefore hopefully, like, the idea is that here the input or the activity would be your whatever activity drives the creation of the toilet, right? If you're planning to say give money to schools to create this, if you're planning to put the government schemes that do this already in touch with these schools to ensure that the schools are able to build those toilets, if you are running your awareness programs or behavior change communication programs that will lead to schools being more and more vocal or being more demanding in terms of creating these toilets, and girls also say demanding that they be given access to these kind of toilets. These are your activities. Your outputs here would be those toilets, right? So for example, if earlier before the program there were 5 toilets out of, say where 15 may be needed, right? Your output at the end of the year may be 10 toilets. You say that after a year or maybe even 2 of us carrying out these activities, the program output should be that 10 toilets exist in the village in schools. Your outcome would be an increase in the number of girls who are attending schools, right? So earlier, where 56% of girls attended schools beyond class 8, now you may say that our outcome, potential outcome, is to say, move that number to 65. This is just an example. Your impact in this case would be the larger impact that this has had on the education of girls in general. Your impact in this case would be the impact that educating girls of that age has on the larger community. It may, for an example, drive down the age or drive down the number of girls who are getting married at an early age. It might drive down the number of girls who are experiencing pregnancies or delivering children at an early age. It might impact the health of newborns and young children as a result of being born to age appropriate to mothers beyond 18 years of age, right? Or at an appropriate age. So that becomes your impact. And this is what an impact assessment looks at. As a result, if you follow what these the indicators or the examples that I've given, you will see that while the output is something that you will achieve perhaps within the course of your program, right? वो 5 के 10 toilet can happen within the course of the program. Outcomes are something that you achieve towards the end of the program, where say 56 or 65% girls have now started attending your schools. And impact is something that takes time to accrue. Impact is not something that happens immediately, right? So for example, whatever benefits accrue to this population of adolescent girls as a result of continuing education is not going to happen at the end of the program. It is going to happen a couple of years or at least a year after the end of a program, where because they have been in school, they've been able to access higher studies. Because they've been able to access higher studies, they've been able to access more livelihood opportunities. Because they're able to do that, they're able to have some sort of agency to say that they would prefer to marry at an older age. They would prefer to have pregnancies or carry children at an older age, because they are more aware of having received education till a much later age. They will be more aware of the kind of nutrition to provide the children. They'll be more aware of how to take care of children during and after during pregnancy and after delivery, right? So these are impact always accrues after a period of time after the program is ended. As per the present law in force in India, an impact assessment is to be carried out after a period of 1 year after the program has ended. So if your last program activity was carried out in September 2020, your impact assessment needs to happen in September 2021 or later. The rule as of now is that it should happen within the financial year, where 1 year after the program is over. So that gives you time till September 2021 to March 2022 to carry out the impact assessment. Now, the good thing is that the onus of this is on the companies. So it is on corporate clients too, because this is a CSR law and not a general, social organization law or a law for general non-profits. The onus of organizing, of engaging assessors, all of this is on companies. However, it does become important for NPOs to have documentation in place to ensure that this impact assessment is able to actually showcase the totality of their activities, to showcase the actual impact that those activities have had. I will very quickly go through the steps of the impact assessment. These are very similar to the longitudinal assessment studies that we spoke about, where the first step is to develop a strong theoretical framework. The reason I mentioned this at the impact assessment stage is that we often come across programs where a theoretical framework is not created at the time that we do the impact assessment, which is actually a year, or even before the law came into place. It used to be at least 8 to 10 months after the program is ended. In that case, we can create a framework retrospectively in sort of mutual discussions with the program team, but we do always encourage that teams do this before they begin their program. The next is to determine a sample and recruitment plan. Again, very similar here. The sample determination of sample mostly talks about the quantitative sort of the sample size that we need to look at. And the recruitment plan is again just to see how we can speak to them, because with an impact assessment, what often happens is because a year has gone by since the program was over, it is sometimes difficult to get stakeholders to participate in these activities, which involve maybe 1 hour long surveys or interviews, etc. The third is to collect data from all program stakeholders, the collation and analysis of that data, and last is to use the findings to determine the program impact. Now, this impact may be used by the implementation organization to design future similar programs. It may be used by the corporate client to make demands of similar programs that they may want to fund in the future. But the basic or the major outcome that we have of an impact assessment is to draw a causal link between the program activities and the changes in the target group that may be seen, and an identification of all intended, unintended effects of the intervention on the stakeholder group as well as the larger community or ecosystem that they reside within. The last is a social audit. So this is something that is going to become very, that is going to be a term that we are all going to hear a lot in the future. This is something that is going to be made mandatory for all organizations that are going to enlist themselves on the social stock exchange that is now been passed and is in the formative stages presently in India. Now there is going to be a little bit of a confusion that is not presently clear. So I'm going to give you both the definitions of a social audit as they exist now. But essentially, a social audit is meant to be a sort of an accountability tool that measures, evaluates, and identifies gaps in the service delivery of social programs while the programs are still ongoing, right? So this is an kind of evaluation or an accountability activity that is carried out during the course of the program. As of now, till now, what has usually been referred to as a social audit has been a very participatory process, by which I mean that the intended beneficiary, or my preferred term is primary stakeholders. The primary stakeholders of the program become a part of this process. This ensures that there is transparency and accountability. The stakeholders are able to demand, or more than that, are able to ask for what it is that the program aims to do, and look at the gaps that exist in terms of what is promised and what is actually delivered, to be able to say or ask questions in terms of why a certain thing is not happening, to be able to point out any gaps in efficiency and effectiveness. This is what a social audit has been till now. The SSE presently in its various, as of now, it's a very unstructured kind of thing, which has a number of documents that have been released by various ministries and the ICAI, and everybody has used certain terms very loosely. But as of now, the present ICAI documents, which have invited comments on the SSE, presently define a social audit as an audit of the social impact of organizations. It does not define whether this is going to be only the implementation organizations. It does not define whether these are going to be the companies that are going to engage NPOs and enlist themselves on the SSE as donors or funders. However, we do know that there is going to be a component of social impact in this assessment. What we do not know is whether this will be conducted by simply an auditor, which is what the current documentation around this seems to suggest, is that there will only be a social auditor that will be right, only a social auditor who will look at this. But earlier this was something that was a participatory approach. I see Devina's messages. There are only 10 minutes left, so I'm going to rush through the next things. I'm going to very briefly just a minute. Touch upon some common methodologies and methods that you may have heard of. Quasi-experimental research studies are studies that involve a comparison group, which is a group which is very similar in their demographics and other indicators to your primary stakeholder group, but is not given the intervention, and therefore can be used to compare on indicators and used to draw a causal link for any changes that may have happened with your treatment group, which is your primary stakeholders. Longitudinal studies I have already spoken to you about. Cross-sectional studies are studies that happen at only one go, at any one point of the program, and not repeatedly, and therefore do not have any earlier study to compare to. Methods, I feel we don't really have to discuss this. These are some things that all implementation organizations also carry out as part of their activities, where we do key, informative, or in-depth interviews, which are open-ended interviews that are carried on with stakeholders. We are all aware of what focus group discussions are. Transit walks are usually used when we have a certain geography that is part of an intervention, especially in rural areas, where you walk through the area to observe all the assets, to look at the setup of the area and see what can be, how they can be used, or how present things that have been put in place because of a program are being used. And case studies, of course, highlight exceptional successes or maybe in some cases exceptional failures of existing social programs. In terms of an importance of MEL, I am going to again, like this is, I think we have largely kind of covered this while speaking of the various assessment studies, but essentially how a MEL framework is different from assessment is that for assessments, what is usually suggested is that a third party assessor comes in as an unbiased, observer of all that has been done, while an MEL framework is something that is very important for an implementation organization to have. Monitoring is something that needs to be carried out periodically in order to ensure that any change or any kind of untowards or unfavorable unsatisfactory activity is immediately identified. Evaluation is where you identify why that activity is happening, why there is a certain result that is not in line with what we were expecting, and learning is where we use this to improve whatever is causing this misalignment with our outcomes and actual reality, and use that to continuously improve the program. I have with me also what an MEL framework should look like. I will of course be sharing this presentation, and hopefully this is something that we can look at. But to very briefly go through it, we essentially want to identify what we are monitoring. These are the large buckets that you will look at. So for example, you might be looking at toilets, and specificities might include, say, running water, or a drainage system, a waste collection system. Indicators would actually include the number of all these things. A definition is just for you to understand what you are defining the indicator as. The second part of a definition would also be a calculation. So in case where we have an indicator that needs a calculation, for example, you say education awareness, right? So how do you calculate education awareness? Is it the number of people who are aware that schools exist? It is the number of people who are aware that they need to send their kids to school at a certain age, or what? So that is what you use here in the definition. You look at how the indicator is calculated. A baseline here is essentially what is your baseline value at the beginning of the program. Target is the target value after the end of the program, or at whatever stage you're doing this evaluation. A data source is where you will source this data from. Frequency is when you will measure it. Responsible defines who collects this data or who is responsible for reporting it. And reporting looks at when you will report it, either to a central program team, or to a client, or a corporate, whoever. I've already spoken of this, but I do want to touch upon the role of implementation organizations, even beyond MEL, in assisting or ensuring that an assessment provides a true picture of the programs that have been conducted, a true picture of the impact of the activities that you undertake. Is to maintain data, documentation, and internal versus third party validation. I think I've largely covered, but what I would like to mention here is that within the frameworks that I've shared, there are also a lot of other things that I'm sure all of you feel are more relevant in terms of the data that needs to be collected. It is very important that it is collected periodically. It is very important that it is maintained digitally so that it is not lost. It is very, very important that there is some sort of documentation to back up that data that exists, to ensure that nobody is able to raise any kind of questions on the authenticity of that data. With that in mind, I think I'm largely at the end of what I wanted to say. At Samhita, we do have certain workshops that we like to carry out. We do have certain platforms that we like to use to build the capacity of NPOs to maintain data, to be able to assist in good data practices and ensure that good assessments are able to be carried out that reflect truly the programs that they undertake. And again, I don't think we have the time to go through this, but I will be sharing this presentation, and I hope Devina is able to share that with all the participants. And we would, I would encourage any of you to get in touch with me to explore more of these activities that we carry out to build the capacities of implementation organizations to be able to undertake all practices that we have spoken about today. So I think, yeah, that's it from me. Over to you, Devina.
Did I want to spend a couple minutes on this slide? I think we could, and I don't see questions in the chat box. So I think we can go ahead with maybe another couple minutes on the slide.
Sure, that sounds good. So I think just a minute. Right. So I think at Samhita, what we normally do here is a larger organizational development perspective that we take, where we look at strengthening social change organizations by either scaling them up or reshaping the context of their, presence or strategic presence within the entire development value chain, we can call it, or the creation of new systems for organizations in order to carry out all these activities. As a part of this, something that we like to do is what you can see on your screens right now, where we like to identify and clarify links between an organization's missions and its activities. We like to help them define their strategy, the tasks that they will undertake in order to, take care of their strategy, the system and formal structures or what we call institutions that need to be put in place to ensure that these are not person dependent, right? So the idea when we do organizational development is not to just build the capacity of a person, but to build the capacity of an organization. And when we build institutions, it ensures that there is sustained change. If somebody in the organization has learned something and instituted that, even if that person does not remain with the organization in the future, that institution carries on and that learning is still carried on in the organization. In terms of scaling up social change impact, this is something that a lot of organizations, implementation organizations seek to do, which is where they want to expand or build, excuse me, external relations, which may be relations with partners that can help them implement, partners that can help them reach their preferred stakeholder group, or even funding partners. The next thing that they also or sometimes look at doing is creating innovative programs with a certain value addition, with a certain novelty factor that will allow them to be helpful, but also attract the right kind of stakeholder group to become engaged with them, participate in larger coalitions, reach as large a group of stakeholders as they can, and engage with key actors and eventually perhaps policymakers if that is within the scope of your organizational strategy or policy. The third thing that we look at while looking at OD is creation of new systems for organizations. This is largely the institutionalization that I already spoke about, where human and organizational processes are created in terms of team building, conflict management, designing, your HR kind of structure within the organization, what kind of uh, intra organizational interventions can be carried out when needed, and the redesigning of technical and structural arrangements to make space for all of this. And the last is reshaping the context of strategic agencies. So, like I said, sometimes when an external vision that has been a vision of the organization that has been created may not be aligned with what, say, a funder is seeking to fund, may not even be aligned with what a stakeholder group is seeking to achieve. So we allow for these contexts to be strategically reshaped so as to still keep the mission of the original mission of the organization intact, but be more attractive to the primary stakeholders as well as to any kind of external funders who may be interested in that specific thematic area. We look at mobilizing for collective action, and lastly, creating alliances to support reforms. The creation of alliances has been something that Samhita has been, very, very successfully leveraging throughout COVID to reach different kind of stakeholder groups. We have had alliances that have helped pharmaceutical workers. We have had alliances that have worked with communities who we expected to have the most kind of face the worst economic, uh, issues or challenges as a result of COVID, people who work only the cash economy kind of professions. And we have created workers alliances, we have created the pharmaceutical alliances, we have also created the Revive Alliance, which looked at financial inclusion of some of these groups. So that has been something that we've been very successful at, and we would like to take this learning to more and more organizations and help them become a part of these alliances, which involve persons with domain and theoretical knowledge, persons who are practitioners, funders, as well as the implementation organizations who are our last mile partners and carry out or sort of, take the support to the actual stakeholder. So this is largely what we do as part of our OD practice. Some of these slides talk more about in detail about the specificities of what I have already discussed. There is also a section on the workshops that we offer. And like I said, if any of you or your organizations are interested in all of this, I would encourage you to reach out, and it would be lovely to hear from you and to partner with you and take this ahead. I think, yeah, that's it for me, Devina. I think we can.
Thank you. Thank you, Divya. I see one question, and I'm assuming it's a lot of information to take in. So I'm quite sure everyone's looking forward to the presentation that you share with them, and perhaps they'll get back to you with questions. I see one question. What would be the minimum ideal time period for a program to conduct a longitudinal study?
So largely, I mean, no, what we normally see is that programs tend to start out with a time period of 2 to 3 years, in which case we suggest a baseline study right before you begin, a midline study at 18 months, and then an endline study at the end of the 3 year period, which is 36 months.
All right. Okay. I see a very specific question for Samhita, so I will maybe that's something you could take offline. We have one more question. What determines the choice of evaluation design?
So it really depends on your goal. So for example, if you are looking at the kind of program where you are tracking existing indicators, right? So for example, toilets, then you look at longitudinal studies which help you see where data has moved. In some cases, you might be looking at programs which are meant to institute a change which on an indicator that does not exist, right? So in that case, a longitudinal study may not always make sense. There is also logistical factors that I spoke of. For example, the cost. Longitudinal studies tend to be really expensive. So people do try to do, say, a baseline and then directly an impact assessment, which helps them look at their impact. And impact assessment is definitely very, very crucial, right? So where an end program evaluation tells you of your output indicators and outcome indicators at the end of the program, it is an impact assessment or an impact evaluation that tells you whether the larger impact that you set out to achieve has actually happened in the for the community or for your stakeholder group. So these are just some of the factors. There are, of course, other factors in terms of resources, in terms of what your program design has been. So for example, if there has never been a baseline, it does not make sense to have an end program evaluation. So some factors like these.
Sure, thanks. Sorry, my bad. I think Ankit had asked a question. I saw Samhita and I thought it was very specific, but I'll just call that out. We could take that question. So Ankit from Touching Live says, thank you so much, Divya, for the session. Very informative. Could you please share what is the approximate cost involved for conducting need assessment, impact assessment studies, not just from Samhita, but general trends? Let's say for a small organization working with 4 to 5 slum communities and suburbs of Mumbai.
Right.
Yeah.
Okay, so I think firstly, Ankit, thanks for the question. I understand that this is exactly the kind of information that you need to make these decisions. So generally, irrespective of the size, what happens is that a sample size after a certain number tends to be very similar, right? So for 10,000 or for 20,000, a sample size with, say, a confidence level of 95% and a confidence interval of 5 would be somewhere around, say, 280 to 350 persons, right? So I will keep that in mind as while giving you that cost. So for that kind of, for reaching a sample of that size, for reaching those many people within a limited geographical area, normally the cost would be around, say, between 3.5 to 5 lakhs for an impact assessment. And I mean, for a community needs assessment would also be similar because the activities in general are the same. It's the tools that are different and the analysis that is different. But at least at Samhita, and I know that some other organizations also do it, when we are taking or doing this for smaller organizations, that we are doing this for organizations that are actually NGOs or implementation organizations. Usually a lot of research organizations have some sort of mechanism to cut down on either their usual organizational costs and something to provide some sort of discount in order to enable these organizations to afford these kind of studies. We do partner with a lot of NGOs where we carry out the study for them. And in terms of going for the study, like I said, some of these studies are extremely important. There is absolutely no way that you should go into a community with a full-fledged program without doing an assessment of their needs. And at the end of your study, if you have not had an impact assessment, anything that you are able to say has been a result of your study becomes anecdotal, which is not just detrimental to you from a organizational development perspective, but is also detrimental to you when you're trying to report to a client or get funding from somebody, and your reporting of an impact assessment of your impact is anecdotal. I hope that answers your question.
Yes, I think Ankit says yes. Divya, I know we're over time, but can we take one more question? Shreya, if you're here, would you like to unmute yourself? Go ahead, ask the question.
Yeah, hi. Thanks, Divya, for the session. And it was quite informative, and I'm sure it's going to be quite helpful for us. My question is, what should be a minimum or a maximum duration when we look at a data collection, right? Because each organization, based on what is our vision, I mean, what should be the period to do the data collection?
So, Shreya, firstly, thank you for your comments. But do you mean the duration of the data collection as a number of days when the data collection should happen, or the time period at which the data collection should happen?
The time period at when the data collection should happen.
So again, it is dependent on the kind of study you do. So, for example, a needs assessment should happen at least roughly, say, 6 months or so before you plan to begin a program. That gives you the time to collate your findings, analyze it, create a program design, but at the same time have your findings be relevant to whatever stakeholder group you're going to do your study or do your project with. For a baseline, it should happen right before or right after program study activities have begun. A midline should happen roughly at least 12 to 18 months after a program has begun, and end program evaluation happens right after we have ended, and an impact assessment happens at least a year or after the program has ended. So that is when the data should be collected.
Okay.
Sorry, there was on the same lines. If it's an ongoing program, right, which is running for years altogether, and we want to measure an impact, let's say an organization is working for 20 years or so, and with the same program, right? When would it be a good time to measure the impact? I mean, would the benchmark for me would be after every 5 years or 10 years or 15? What does that looks like?
So here, what you need to do is look at the stakeholder group that you're going to be collecting data from. So for example, in 20 years, if you're working, say, with, the same village, for example, right, then people that you work with will keep changing. So the idea should be that at least whoever you are assessing should have spent at least a year experiencing the activities of the program. So for example, if you've been working with them, they should have experienced firstly a year of your activities, and a year after that is over is when they can do that. So I think like for an organization to use that as a learning tool, it is very dependent on you in terms of what kind of resources you have in terms of funding, in terms of access to research organizations to do this. But essentially everybody that you want to assess, which is your primary stakeholders, should have had some time to realize that impact. So let's say roughly 1 year of experiencing your activities and 1 year after that to experience the impact should be something that you should take as a benchmark.
Thank you.
You're welcome.
Great. I think we're going to wrap this up with this question. But as you can see, I think people were just warming up to the session and just thinking of all the questions they have. Everybody, you can see all the contact details are here. We will be sharing Divya's contact details with all of you. So should you have any questions, please feel free to reach out to her. With that, thank you so much, Divya, for taking the time out. Thank you, everyone, for taking the time out and attending this and participating. Thank you. Have a great rest of the day.
Thank you. Thank you, everyone.
Thanks, Davina. Thanks, Divya.